Hello, my name is Andrew Kohlmeyer, and today I would like to talk about medical massage for treating migraines. So basically, what you want to do is you want to ask your client, do they get sensory organ headaches? So you don't want to ask migraines because people always say like, "Oh yeah, I have migraines." But it has to involve the sensory organs to kind of be like a true migraine. I'm sure there's like little variances, otherwise, but the majority are like the sensory organ kind of headaches for migraines. So you have the auras for light, you have sound disturbances, all kinds of things with that. Dizziness, you feel like you're gonna, throw up, things like that. So basically what it is they have to have the gene to get the migraines. So there's a gene, and it's, there's a whole science behind that. And it's basically what happens is any kind of initial inflammation forward of the vertebrae. So here's like the vertebral border, so anything forward of that is where they're going to have the migraines. And simply because there's not like a lot of nerves back here. You have one, the dorsal scapular nerve right there, which is, for shrugging the shoulder. And that's basically it. There's one other one, but, it's mainly that's pretty much it. Humans are kind of built for battle. There's not a lot in the back where it's unprotected, and it's mostly forward of the vertebrae, and it's not in there, very nicely. It's really, the nerves are kind of really smashed in there. They're pretty tight, close together. So what happens, you'll have mineralization in here, and that is what drives migraines. So you have the initial inflammation, which is brought on by this soft tissue mineralization. So basically, you move your head all around, head and neck, and you get, the nerves that run along there basically get torn up by that mineralization. So you can't have that. So if you have someone that says, okay, yeah, I do get sensory organ headaches, and they say, I have auras and, all the horrible things that migraines can bring on. And you want to make sure their neck is absolutely clean forward of the vertebrae line. It also helps for other headaches, the more tension headaches for here, which would be the dorsal scapular nerve and, occipitals, stuff like that. But this, they're not going to truly get away from the migraine response until you clean this out. So you do have to go in there, and this is the perfect position to get at it because they're going to be totally relaxed. The side laying stuff, that's just it's not going to work. They're not going to relax because this is painful. You're digging out basically broken glass kind of feeling stuff, so you want to get in there and clean that stuff up. And also, before you even go in there, if they're really bad with lymphatics, you got to go in and make sure you get that out first, because that's going to lower the pressure down so they don't experience a lot of pain, with them being basically swollen because they're backed up lymphatically. So how that works, I'm going to move the camera here a little bit, is that the legs drain into about here. It's called the cisterna chyli. And I'm going to draw that out, so it's the structure right in there. And from there, it goes to the thoracic duct. That's on the anterior side of the spine. So you need to have the vertebral edges need to be of a lower tone to drain into that thoracic duct. So, here's your vertebrae. It can't be tight there. You can't, it's just not going to work. It's corresponding to, so if these are tight on this, these vertebral borders, it's going to fill in here. And here's not like the best thing either, too, because your abdomen, all your organs fill up with fluid with that. And that's pretty uncomfortable. People always say, oh, I feel so bloated, stuff like that. That can be sort of a cause from that. So, onward, up, you want to make sure that that's cleared out pretty well. And into the shoulder, it's important that you take care of this too. So you'll have your rhomboids in here. You want to make sure those aren't, overly mineralized as well. I talk about soft tissue mineralization all the time because it's just the base thing for medical massage. I mean, that's all day long. That's what I'm going after, is soft tissue mineralization. And it's just, each structure needs to fit, like a puzzle piece into the next structure. So you can't have soft tissue mineralization around any structure. You're just not, it's just not going to work out. You're going to have pain. Pain is basically intrusion on the nerve, so you're either getting pressure or you're getting physical contact with that mineralization. So you can't have that. So this is, you got to do the basics first to get to, the migraine stuff, if they're really full. So, onward up, the subclavian vein is right here, on the bottom side here. So you're going to reach under, so it's going to be at the, medial clavicle in the front of the neck. So you want to check that. You want to make sure that's draining. And that just drains right into the heart from there. So you got to make sure that that's okay, or it's really going to hurt. It's going to hurt a lot for you to go in there and get that soft tissue mineralization around the nerves. And what happens, the whole mechanism of migraines is you have the initial inflammation which acts on the nerve ganglia. So you can't have that initial inflammation because it'll ramp up in that nerve ganglia to the migraine response. It's like, I've never had a migraine. I couldn't even imagine. It's got to be so horrible. I don't have the gene, obviously, for it. So, yeah, it's like you got to be pretty thorough and clean that out. But you got to, also, like I said, step one is get the lymphatics out. So you're not just driving your client to the moon with pain. And just take your time. It's a process. If you don't get it all in one shot, it's fine. You're reducing the response. They're gonna feel better. The drugs that you take for migraines are just like epic. They're just not okay. They're, I guess I hear they're pretty dangerous from what clients say. They're kind of dangerous drugs or whatever. Sometimes they have side effects with it. So yeah. So just get in there. You're gonna clean it up, and it's correspondingly you can feel where they have it, so if it's mineralized up to the ear, you can pretty much guess that, they're getting the sound disturbance stuff, they just can't handle sounds, or they're dizzy, because, you also, your ears tell you where you are kind of in space, your proprioception, so, they can be dizzy when they have that response, because it's, that's like a radio signal to the brain that's kind of like halfway tuned out of the station, so they can be kind of dizzy, so the throat stuff, yeah, you're hitting the centers of your throat where it's going to make you vomit. Normally you choke on something, you vomit, so it's common sense that, when you have the mineralization around the, the neck, so that would be more forward by the neck, so you're going to have those kind of responses with that. And the eye stuff seems to be like in the middle there. And yeah, there's a nerve ganglia that's just behind the eye. So they'll get they'll have the complaint of, it feels like I have a nail in my eye, and there's a nerve ganglia that's just right behind the eye. It's like I couldn't even imagine what that feels like. Yeah, like a nail in the eye, I guess, So that's pretty much it, so that's how you get rid of the migraines. And boy, it is a beautiful thing to give people, their quality of life back when they're dealing with that kind of terrible situation. All right, take care, guys. Hopefully this helps someone. Bye.